We're starting, yeah. Okay, hello, and a very warm welcome to this, the first of the AK Party UK's webinar. My name is Basma Shayal. I will be moderating today's session. Firstly, I'd like to take this opportunity to thank you all for joining us. I'd also like to thank all the distinguished panelists for coming on board at such short notice. As you will hear, each of them have formidable experience in their respective fields, and they will be contributing valuable perspectives to this discussion. Today's theme is very lively and timely. Witness the way in which the current crisis is developing in relation to COVID-19, and it's becoming increasingly clear that any effective attempt at combating it need to be global and they need to be collaborative. This crisis knows no borders, and neither should our response. The AK Party UK plays an instrumental role in facilitating the outreach and dialogue, bridge building between Turkey and the UK. And all of these are key to this process. Both countries are NATO members, and each of them has an enviable health system, which is amongst the world's best. However, there's a great deal of overwhelming pressure on all the infrastructures worldwide, and this clearly necessitates a strategic global response. So these are some of the themes that we're hoping to touch on in today's session. Before we start, I'd like to take this opportunity to acknowledge, first of all, the incredible efforts that continue to be made by nations and by countless individuals on a daily basis. And quite often these are at great personal cost and sacrifice. Plenty of these events continue to dominate our heads, but frequently it's the unsung heroes and the heroines behind the scenes that offer the greatest sacrifices and whose work truly touches those around them. So to proceed, today's session will begin with a welcome message from the AK UK's chairperson, Brother Abdurrahim Boyinkan, and then we will hear contributions from each of our panelists, who I will briefly introduce before speaking. You'll notice that there will be a slight change in our lineup from that was advertised. Professor Simpson has had urgent COVID-related work, and his colleague, Dr. Salter, has kindly agreed to step in notice. Then we will have an opportunity for questions when all the panelists have spoken. So if you've joined us using the Zoom application, please feel free to submit questions in writing. There's a Q&A tab at the top of the screen, or if you'd like to indicate that you'd like to speak by using the raised hand icon, please do so when the speakers have finished, all of them. Finally, today's session is being transmitted via TRT and Al Jazeera Mubashir. We're also recording it for uploading onto the AK Party UK's website and Facebook shortly. It's being live streamed on YouTube, on Facebook and Periscope. So with that, I would like to hand over to Rahim, the AK Party UK chairman, and I look forward to joining you in what will be, what promises to be a very engaging session. Thank you, Abdurrahim.
Thank you, Basma, for moderating this webinar. I would also like to thank all our guests for joining our Party UK's first webinar on this lively topic. The pressure of COVID-19 on the public health services in Britain and Turkey is significant. It is also very challenging. We are here today to learn from the experiences of both countries as we try to deal with this pandemic. I'm truly grateful to the panelists for joining us today. Your presence, albeit online, is indicative of the seriousness of this issue and our collective resolve to overcome this crisis. So thank you, Mr. Cevdet Yılmaz, Margaret Salter, Lord Richard Balfe, and Dr. Eamon McCoy. I look forward to the presentations and the discussion. So thank you.
Thank you so much, Abdurrahim. Okay, so the first of our speakers today is Lord Balfe, who will set the scene. Oh, okay.
But he's not online, I think.
Just getting message through now, he's not online. Let us move swiftly on then, in which case, Dr. McCoy, a very warm welcome to you. Dr. Eamon McCoy is a consultant anaesthetologist at the Royal Victoria Hospital in Belfast. He is also the founder of Ideals Medical Charity. This is a really visionary initiative that has made a real difference to the lives of thousands of people around the globe. I'm also reliably informed by surgeons that his groundbreaking research and contributions into the medical field, in particular his invention of the McCoy laryngoscopy, and his approach to dealing with difficult airway techniques in teaching are priceless in their work. So that's a very personal recommendation there. We look forward to hearing about public health in action from Dr. McCoy and his experiences of frontline workers on the ground. So over to you. I think this is a perfect example of how we have technical issues sometimes. Dr. I think your mic is muted.
Lesnar, I don't think Dr. McCoy is online at the moment.
Yes.
So you might need to try and get him back on.
Let us move on. No problem. This is right. This is a perfect example also of thinking on our feet. So let us move on to Dr. Salter, and then hopefully we will bring in Dr. McCoy shortly. Right. So Dr. Salter has kindly stepped in at last minute. And as I mentioned before, Dr. Salter is a consultant in global health. He's also a senior advisor to Public Health UK. In his role, he coordinates the international efforts of PHE in establishing bilateral links with nation states and regional networks. He also responds to requests for public health opinions in response to public health emergencies and humanitarian crises. He's a consultant in communicable disease control, and he has a PhD in arena virology. I had to look up what that means, actually. So he's also extensive experience of disease control and incident management in the UK and globally. And he will be speaking today on the UK government strategy with regard to the impact of COVID-19 on the NHS and beyond. Okay, so we do need to unmute Dr. Salter, please.
I have unmuted.
Wonderful, thank you.
Can you hear me?
We can hear you, thank you. Please go
Jolly
ahead.
Good. Well, I apologize, I'm not going to be able to offer any slides. It was relatively short notice that I was made available, but very, very happy to do this. I think, as was mentioned a little bit earlier, international collaboration on what is a global issue is the only way that as a globe we're going to be able to fight this. And this applies both to Turkey, the UK, and all other member states. I think it's salient to remember that this would be the week that the World Health Assembly would be convening in Geneva. But because of the COVID, it won't be. So we are going to be using technologies such as Zoom we're using this afternoon to enable all the member states and recognized bodies within that WHO to come together to discuss not only COVID, because whilst COVID is the major threat to all of us at the moment, we must still remember that internationally, all of the other health issues and inequalities that were preceding COVID have only been exacerbated because of COVID in many countries and states around the world. So I've been asked to talk a little bit about the UK's, particularly its position and how we got to it. What I think I'd like to do is to start with a little bit about PHE, very briefly, put it into context of where PHE sits into the response mechanisms in the United Kingdom, and build on that role, because it's mainly through PHE that I have been working, interlinking, as you'll hear as we progress, with other UK government departments, academic institutions, and other groupings that are of significance in dealing with the response and coordination in the UK, such as I'm sure many of you are aware of the local contingencies arrangements through the local resilience fora, which includes, as you might imagine, all of the blue light services, the NHS, local authorities, and also the larger utilities, which in circumstances like this actually become quite important, especially when we're looking at a significant number of individuals who have been furloughed, many of whom may or may not have jobs at the end of all this. So there's going to be a major impact upon the public health, not only of the individuals in the UK now, but well into the future. And I know that many of you will have heard about many of the discussions about the mental health impacts that isolation, shielding the vulnerable is creating and will store up for the future. So For those of you who may not be aware, Public Health England is an executive body and answerable to the Secretary of State by our Chief Executive, Duncan Selby. We've been formulated now for 8 years. We were brought together 150 organisations to form the Public Health England, which before was a very much more fragmented grouping of public health groups, with the Health Protection Agency being the predominant one. But now we have on board surveillance of cancers, we have immunizations pulled in, we have health protection, health promotion, and knowledge management. So we cover the whole of the gamut of public health activities that one might imagine. And in that role, as an executive body of the Department of Health and Social Care, we are the primary focus for technical public health advice to the UK government, both the Department of Health and Social Care and other government departments, as well as, many of you will be aware, supporting organisations around the world, both through the International Association of National Public Health Agencies and bilaterally with a number of countries where we work across the Eastern Mediterranean, Africa, South America, and Asia. So our response, obviously, it was only very early this year that PHE became fully aware of the implications of the new virus that was first noted at the end of December last year in Wuhan in China. In the first instance, PHE did stand up a small observation group, which is what we would normally do on the back of international information that there was a new virus emerging or a new outbreak that might have significant impact upon the UK. Primarily, so we had some thought processes through agreed processes to be aware and take action as might be required. It became apparent when cases started appearing in Europe and ultimately in the UK that the UK would have to step up a very much more significant response. And PHE's role in that is obviously one of providing the public health information. So very early in February, we established a wider grouping. It was declared alert level 5 for us, which is our highest level of alert, which means that we were able to commandeer groupings within PHE to support the Public Health Agency's response to supporting the UK and further internationally. And within that, we set up a number of cells under an incident director. And these cells, as you might imagine, covered everything from developing the clinical and external guidance so that people were aware of the best public health methodologies to stop the spread of the virus in the first instance, to the clinical management, adjusting and looking at the best clinical methodologies for supporting those individuals who were admitted to hospital or indeed those who weren't. We also had further scopes looking at port health, which I'll touch on a little bit later, our helplines and inquiry systems, our senior medical advisor grouping, as well as a whole plethora of other support and logistical setups to support the operation, but it will also support the delivery of that operation to other departments across the government. Now, how does PHE fit into all that? We have lots of cells, but we are relatively small when it comes to the operational incident experience. What we did learn from this that regrettably, in peacetime, we would actually develop our capacities and we would have people trained to become incident responders, incident directors. But people leave, people retire, people move away. And when we actually came to the start of this operation, it became apparent that the significant number of people who had been trained, many had moved on from PHE and were no longer available to support that. So the early phases were not also developing the response methodologies for dealing with the COVID, but also ensuring that we had appropriately trained staff within PHE to fill those roles. And as one might imagine, it was a very steep learning curve for many of those who came on board. So I can't stress enough the need to ensure that you are training people before the incident and during the incident, because people will get very tired and you need to have that resilience so that you can continue in the face of other people becoming unwell, physically tired, or needing to spend time with their family, not least because they might have contracted or developed symptoms consistent with the COVID-19 infection. So we have PHE, we have our groupings in that. How do they react? Well, our main interactions in providing the scientific advice are through a group called the Science Advisory Group for Emergency, SAGE, and through a SPIEM group, which is the Strategic Pandemic Information, particularly for modeling. PHE has a large group of modelers, but we haven't relied on just the capabilities within PHE to provide that modeling, which has provided a lot of the drive for the government understanding the spread of the disease, both the nowcast and the forecast. But we work with many other academic institutions across the United Kingdom, and we draw on information from academic and public health agencies globally. So we're regularly in communication with the Robert Koch Institute in Germany, the National Public Health Institute in Norway, CDCs, and others around the world, just to ensure that we have the most salient features, the most salient data that we can then interpret in light of the UK's particular situation. We then feed into SAGE, and within SAGE, it's not a political grouping as many people, I think, outside of the immediate grouping believe. It's a grouping of scientists from academia, from government agencies, and internationally, who come together and examine the data and prepare specific briefings at the request of COBRA, the Cabinet Office Briefing Room, to inform the Cabinet Office and Number 10 so that they can make policy decisions based on the most accurate and salient scientific information available when the question is asked of us by the Cabinet, by COBRA, or Number 10. Notwithstanding that, we've also, over the last couple of weeks, been working very much more closely across government. At the outset of the outbreak in the United Kingdom, there was lots of discussion and debate and development of guidelines, which many of you will have seen on the .gov.uk website, which give a framework for members of the public to understand what is happening, to understand how they can protect themselves, how they can protect their families, and how they can go about a resemblance of daily life without enhancing their opportunities of contracting the virus. And that is where the social distancing, the hand washing became evident. And the key messages you hear now of the 2 meters, of washing your hands for 20 seconds frequently, of sneezing into a tissue and then putting it in the bin and leaving it 72 hours, or sneezing into the crook of your arm, if you don't have that handkerchief or other mechanism for disposing of it most effectively. Over the last couple of weeks since lockdown, we've been thinking about and working with cross-government departments to provide the appropriate public health advice to facilitate the timely opening of other activities, both across government and across the economy. So we've been working closely with the Business, Energy and International Strategy Department to help provide guidance to industry, to factories, to shops on how and what information they need to assess and what mechanisms they need to put in place to adhere to the social distancing, the 2 meters, the hand washing, so that individuals can start, where appropriate, going back to the workplace, contributing to the economy, and also giving them that opportunity to take back their place in life. The lockdown for many people has caused many problems because they found themselves without their day-to-day activities, which has impacted upon mental health. And we've seen that in the number of suicides and parasuicides that have been occurring in the United Kingdom over that time. Equally, we've been working with the Departments of Trade, the Departments of Transport, the Departments for Education, all key departments. And you'll have heard last night in the Prime Minister's discussion that I haven't seen the document, it was due to be published an hour and a half ago and is going to be discussed at 15:30, I believe, so in 3 minutes' time. So we will all be very much more informed, I hope, on what the next steps are. Because as I'll go back to the beginning, PHE provides science-based evidence for SAGE to inform COBRA, to inform Number 10. It is in COBRA and Number 10 that policy decisions are made, and PHE can influence them through providing the science information, but it has no direct impact or effect on developing the policies which the government would actually want to take forward. And within that, I think there are 2 key areas that I think are worth talking about. One's port health. There is no scientific advantage demonstrated throughout the world in previous outbreaks, whether that's SARS or the H1N1, that thermal screening has any basis in scientific factors having a benefit. However, politically, it gives an opportunity for the public to see that the politicians are taking these things seriously. In the UK, it's likely we might see that at points of entry or points of exit in the next few weeks, not because the government are ignoring the scientific evidence, but in the absence of exit thermal screening from the UK, people may not be allowed to board aircrafts and off the plane because many countries are taking on board thermal screening as an entry requirement. And if it's not done at exit, they won't allow planes to actually land in the first case. So we're being quite pragmatic about that, realizing the scientific evidence is really quite weak. And in the first few instances, the port health, we had screening checks, which are usually asking questions of people, where have you been? Have you got symptoms? And not relying on temperature to be any significant indicator that a person might be infected, because this virus started occurring at the time of year when many respiratory illnesses are abundant, and the discrimination of specificity and sensitivity using the basic diagnostic criteria that were initially used are being refined, but were not sufficiently significant, sensitive and specific to ensure that all numbers were captured. So we dissolved our port health grouping a few weeks ago after we'd repatriated most of the individuals from the British nationals from cruise liners or around the world. But we will be standing up a port health light, I believe, very shortly to deal with the desire of the UK to have a more significant screening program for entry into the UK, which may or may not involve quarantine. But as you've heard this morning, there are certain countries that will be exempt for that, certain groupings that will be exempt for that, and we'll wait to see what ultimately that policy decision will be. And then finally, I think one of the other areas that's obviously playing on lots of people's mind is the testing, tracking and tracing. Currently being piloted in the Isle of Wight, where there's been a good penetration of the application developed by NHSX to smartphones, with approximately 1/3 of the population in the Isle of Wight, 50,000 people now having that application. Data is beginning to flow. It's too early to have had the opportunity to analyze that. And the expectation is that the app will be rolled out in the next couple of weeks once a few of the glitches have been worked out. However, for testing, tracking and tracing to work, it requires a significant capacity to test. But not only that, it requires the ability to be able to get the sample swabs to the individuals who require testing, back to the laboratories, and have the capacities in the laboratories to do that testing in a timely manner. You'll be aware that the Secretary of State was looking to have 100,000 tests available per day by the end of April. That was achieved, and we'll leave it at that. Subsequently, we haven't quite seen the 100,000 reach, but over the last few days, that number has been all but achieved. So we now have about 100,000 tests available today. We will need a lot more than that per day if we start testing, tracking and tracing too soon. Because you can imagine if one person is found to be positive, with any let-up in lockdown, they will have multiple contacts. All of those multiple contacts will need to be traced, and so will some of their contacts. So it becomes an increasing number of individuals depending on the level of contact tracing you do. So we can only realistically put that in place when the numbers of proven cases are decreasing to a level which becomes manageable. To achieve it at the moment, we're looking at having 3,000 medically trained individuals to oversee much of this work. But at the present moment in time, coordinated through the Department of Health and Social Care, they are recruiting 18,000 contact tracers. Mm-hmm. This is in addition to the contract tracing that will be offered by the NHS application. So it's a significant and major effort required to control the spread of the virus. Everybody talks about South Korea having had a fantastic mechanism for doing this. It worked quite well until quite recently, when there was an outbreak associated with a few nightclubs, and they are now tracking that down in Seoul using the similar methodologies, very much more stringent, using methodologies within the UK people have not been used to. The UK, as you're aware, is more of an open society. There's not quite so many rigorous laws put in place, and people are not always receptive to being told what to do, but they've done very well over the recent few months.
Yeah.
I'll leave it at that because time is asking, and I'm happy to take any questions. Over.
That's wonderful. Thank you so much, Dr. Salter, and thank you for that. Was extremely insightful window. Firstly, into the structure behind proactively planning for the challenges and trying to contain them. Also, the consequences, highlighting the consequences that many don't speak of this. I think also you touched on the importance of public opinion handling it and how fickle it can be. I think perhaps this is something that we can expand on in the Q&A session. I'm aware that firstly the questions are coming in thick and fast, and also we have other speakers too, but we will return to these points. Thank you very much for starting us off in such a vibe. So next we have Lord Balfe. Lord Balfe, we would like to welcome you. Thank you very much for joining us today. Right.
Is that directed to me?
It is. Thank you.
It is. Listen, I'm sorry there's no video, but the Wi-Fi is very poor here.
Sorry, Doctor. This is Dr. McCoy.
McCoy, yeah.
The speakers. Okay, so with your permission, Dr. McCoy, if you don't mind, we will continue to have you on audio, but we'd just like to welcome Lord Balfe first, if that's all right.
Yes, of course, yeah.
Equipment, and then we will directly continue on with yourself.
Okay.
So, thank you so much. Thanks for your patience. So we have next Lord Balfe, who will outline for us the context of the UK and Turkey's approach to tackling COVID-19 in light of their bilateral relationship. There is plenty to introduce Lord Balfe with, and I won't do it justice if I go on for too long, but suffice to say that he has a far-reaching record in both British and European politics. He's a life peer. He served as an MEP for 25 years and sat on the Greater London Council for 5. He's also a member of the advisory board at Polar Research and Sea Initiative. So without further ado, Lord Balfe, please go ahead.
Right, well, thank you very much. The purpose of members of the House of Lords is to ask awkward questions. You tend to get there at the end of your political career. I've been in politics now for some 50 odd years, and once you're there, you can't be removed. That's why we're called life peers. So because of that, we can actually ask some quite awkward questions, which sometimes embarrass the government, but I've always regarded that as being why we're there. I say that by way of introduction because no one, although I'm a Conservative peer, no one should think that the purpose of my intervention is to defend the government or, for that matter, to attack it. I'm there to give you what I see as an independent view. The first thing about this whole crisis is, of course, that it blew up out of nowhere. If you look at the beginning of the year and what we were doing, the one thing we weren't doing was looking at COVID. We had many other problems, and indeed through the first 2 months of the year, right until the end of February, although it was beginning to surface as an issue mainly in northern Italy, there was no great concern. And indeed in Britain there was very much this attitude of, oh well, let's muck on and get over this. You know, we've had flu epidemics and all sorts of things. In short, no one really judged what was going to happen, and it's very fine to be wise after the event, but having lived through the event, I think the most important starting point is to realise that we really were taken by surprise. The second point that I think we have to realise is that this whole episode has shown the European Union up in a not very good light. What we've seen is that Europe had neither the power nor the resources to coordinate itself to deal with this epidemic. Indeed, the hallmark of the epidemic has been each country devising its own solutions, not just Britain, which is of course now outside the EU, but even within the EU. I still have a couple of jobs in Belgium. I have a flat in Brussels. So I've been back to Belgium for the first time a week ago. They had their own lockdown restrictions. They seemed to work. But the crucial thing is they were different to the French, they were different to the Dutch, they were different to the Germans. One thing this episode has taught us is the difficulty of having a European approach. Of course, health is anyway a devolved matter. It's a matter for the member states. But the way in which Europe responded was, to put it mildly, somewhat disorganised. The way in which the British government responded to Europe was even more disorganised. They apparently couldn't find, I say again, they could not find the emails inviting them to take part in the meeting to talk about common procurement. So we have had problems there. We've also had problems at home. Many people admire the British National Health Service, but what we need to realise is that socialised medicine is a fact of life in Western Europe. Socialised medicine is just as socialised in Germany, Belgium or France or the Netherlands as it is in Britain. And if you look at the way in which socialised medicine runs, having looked at it across the board, and indeed for some years in the European Parliament, having had control of the medical service as one of the College of Questors, I am not the great admirer of the NHS that everybody else is. It is a national health service. That is one of its failings, because it's also a sclerotic health service. When it acts, it moves in a very cumbersome way, and it is not capable of local adjustment in the way that, say, the German system is. So what we've seen is we've got some marvellous new hospitals built for this purpose, very quick, and all of them empty. Now, we maybe shouldn't criticise the government for that, but the fact of the matter is that when this epidemic started, the NHS stopped cancer, cardiology, and a whole number of procedures. So we're in a position where I live in the city of Cambridge. 500 beds were put aside for COVID purposes. Almost 400 of them are empty, but the services that were suspended to get those beds empty have not been resumed. So one of my criticisms, which I've said publicly, is that the government has got to start things going again. It stopped all face-to-face appointments, and it will be some time before we know what the true death rate is of COVID. It's not just people who have died of COVID, it's people who have died of other diseases because they were neglected during this. That's an important point to keep on board. We also have to remember that the National Health Service has certainly done its job at the base level. There is no doubt that the dedication of the workers at the ground level, manning the wards and the hospitals, has been exemplary. But there's similarly little doubt in my mind that there will be some very serious questions to answer when this epidemic in Britain is over. Why was there no protective equipment? Why has it taken weeks and weeks to get the protective equipment here? How many of the people who have died, the frontline hospital workers, how many of them have died because the NHS failed to provide the protective equipment? I think this is a fair question, one that government is going to have to answer. Other questions it's going to have to answer is why the outbreak in nursing homes? Why did it send sick patients to nursing homes to infect other people in those homes? There are similar questions around the prison population. And we now have last night what I can only say honestly is a half-baked idea of quarantine. You can't possibly have quarantine in Western Europe on the basis of everybody being put in lockdown for 14 days after they come back. A lot of us, myself included, have offices in Brussels. What they are effectively saying is that you could no longer have any international work. So it needs thinking out much more clearly. Now, to move on to Turkey, we've had our ups and downs with the Turkish PPE equipment, and I don't have enough knowledge to say what the rights or wrongs are. But overall, there does seem to have been some sort of slip up. And it does seem, if the reports in the paper are correct, that some of the people supplying the equipment have, shall we say, not been in command of state-of-the-art factories in which to manufacture it. But also, I spent 20 of my 25 years in the European Parliament on the Joint Parliamentary Committee EU-Turkey. So I know Turkey quite well. Some of us are concerned that the appearance, shall I put it no higher than that, of infighting between the Turkish political establishment is not doing its best for the Turkish population. We are told, for instance, that the CHP-run relief operations in Ankara and Istanbul were closed down by the government. In fact, I read from a press release, it said that last week, İmamoğlu, the mayor of Istanbul, and Ankara Mayor Mansur Yavaş said, quote, the Interior Ministry had launched criminal investigations against them for starting coronavirus fundraising campaigns in March. This is not good for Turkey's reputation, frankly. One of the things about democracies is that on occasions you lose elections. Turkey is a democracy. That's why these two mayors were elected. But what I would say to my friends in Turkey is don't be too heavy-handed, because these things come back to bite you. If you have another democratic election, there's a strong likelihood that people will not change their views because of this. And if they do, they're as likely to change them one way as the other. So I have noted that Turkey has done very well in its containment of this. I've also noted, of course, the huge, enormous refugee problem that Turkey has coped with, far, far and away more serious than anything in any European country. And the Turkish government and people can only be congratulated for the tremendous effort that they have made to look after the refugees and make life possible for them. I do not defend the European Commission record in this, nor the British government. I think the government of Turkey deserved far more support than it has got. If finally I could just turn to the lifting of the restrictions in Britain. We had the Prime Minister last night. He spoke for 12 minutes. What he said could probably have been contained within 2 or 3 of them, but it's clear that we are heading for the end of lockdown. Now, we have this thing in Britain called social distancing, probably one of the last remnants of the EU. We're told to stay 2 meters away from each other. No one knows said why, because in many European countries, it is 1 meter. And I must say I was rather amused to see that in Lapland, in northern Sweden, people are advised to stay away from each other for the length of a moose being one of the animals to be found in the Arctic Circle. So we do look forward to the easing up. And one of the things the British government is going to find, and probably the Turkish government as well, is that it's far easier to lock down than to release. Already we're seeing a lot of people saying that, oh, they're afraid to go back to work. But we need to be relatively sensible about this. The teachers' union, for instance, in today's paper, has asked that disinfecting of children when they go into school be arranged. But from what we know, children are the least likely people to carry the virus. I think we need a common testing procedure, probably with temperature procedures. We can probably learn from the Far East. But what we don't need is a lot of people deciding that it's rather nice to be at home and being paid by the state, and they're going to stay there. because one thing this crisis has demonstrated is how easy it is to spend public money. We are spending billions of pounds a week, and we're borrowing every pound of it. And one day it's going to have to be paid back. So I think the government now needs to look at the way in which we lift the problem and we lift the restrictions. You know, when I was in a more academic capacity, we used to look at things and we used to say, well, this is the cost of a human life. Of course, you can help. You can never eliminate. Most of the people who have died of COVID have had what is called underlying conditions. Now, clearly we need to control the virus. We need to get the reinfection rate down, but we can't all stay at home until it's 100% safe to go out. That's the lesson that the government is going to have to learn. And I think poor old Boris Johnson is going to find that it's far more difficult to lift the sanctions than it was to put them in place. Not that difficult to send people home on 80% of their salary and tell them to do nothing. It's a bit more difficult to get them back to work. So there's a few thoughts on all of this. I'm happy to answer any questions people have, and I've spoken for my 10 minutes. So back to you, Madam Chair.
Thank you. Thank you so much, Lord Belf, for a very frank and open outline of your views. I do know I've been following your opinions on the union and various other issues, and I think your stance is no secret. And I really appreciate your responses during the question time. I think there have been comments coming through, and they're not questions, so I might just pick up on a few, if you don't mind, before inviting Dr. McCoy to speak to us. So people are mentioning things like, for example, many would say that the failure of the Nightingale hospitals or the capacity of other hospitals not to take on cases other than COVID might be down to, people are mentioning things like draconian austerity measures, lack of political leadership and shambolic strategy from the top, the whole debacle about public-private ownership, which has reduced the NHS and other infrastructure in the country to a shadow of its former self. But those are attendees' comments, and I might invite you perhaps to comment on later on. Thank you also for your insight into and your comments into the position of Turkish politics and the disconnect that can often occur between policy, governmental policy, and public opinion. So we'll be returning to that in a few minutes, if that's okay with you. So, Dr. McCoy, I did thank you very much for joining us. I'm aware that there are issues with your internet connection, so unfortunately we can't see you directly, but everybody has a good idea of what you look like, I think, from the poster. Ah, super. Okay, there's a wonderful.
That's a long time ago. Thank you very much, and thank you very much for the previous presentations. If I could maybe give you a little bit more of an uplifting story. The basics was back in January, because we've got feet on both sides of this, in that at least half the population here don't listen to London, they listen to Dublin. Back in January, the alarm bells were going off here and in Dublin because of what was happening in Italy. And late January, we had our first training sessions on COVID and what we were going to do. With the obvious usual things, PPI needed to be sorted, training on how to use it. So by February, we already had our meetings and our training. We knew it was coming, and we knew it was going to be bad. Didn't need to, there was no magic in knowing it. WHO and ECDC were telling us this, and Tony Ryan from WHO was repeating over and over again the steps that were taken, which is test, contact trace, and isolate. And also stocking up on ventilators. So there were 2,000 extra ventilators available, mainly because over in Galway in the south of Ireland, they make the ventilators, and they were stacked up and well prepared. And then in March, fairly early March, Leo Varadkar, who was the Taoiseach in Dublin, moved very quickly, speaking oddly enough, just after he spoke to Donald Trump in Washington, essentially said they're shutting the country down. And that's essentially what they did. So they were ahead of some other countries. And because of that, Belfast essentially followed the message. And children, although the schools did not close like they did down south, parents did not send the children to school. And that put it about 2 weeks ahead of the UK. Also, we had the resources, they had PPE, and the Southern government took over the national airline and sent the national airline over and back to China, picking up enormous quantities of PPE, mainly by putting the Chinese ambassador on the first flight to go with it. And all the contacts were used. The end result was that we dodged the bullet. Now, there's a lot of reasons why we dodged the bullet. I think we're running at about, I think England is running at 49 deaths per 100,000 of the population. And we're in the north here, we're running at 26 and down south at 22. And it's probably because they moved fast. Who said move fast, move early? You'll make mistakes, but you'll never regret trying to move it because the virus will always catch up with you. So on a practical level here, we had one hospital, which we did the hospitals in Belfast, the three main ones were divided up into three. There was the two fever hospitals, which is following the Chinese model. They were for COVID. And one, which is the Royal Victoria Hospital, the main tertiary referral hospital, was attempted to keep that clean so that we could continue with non-COVID cases in the Royal, and we've succeeded in doing that. For cancer, neurosurgery, cardiology, etc., has kept going through the entire thing. And we did 34 kidney transplants at the height of the COVID. We kept going as well. The second thing was testing. Testing has been ubiquitous, carried out. Every single patient in every single nursing home in Ireland has been tested, and every single member of staff has been tested as well. And the third thing is that the lockdown is stopping. It will start to stop next Monday, the 18th, down south, and it's going to follow here fairly quickly. And the lockdown is being reduced in 5 3-week periods. They say 3 weeks because the incubation period and the illness, they say, is about, median is about 14 days. And they say, give it another week after that, and different stages. So the last thing that's going to open will be pubs, and that'll be in August. So it's been a step-by-step thing. And out of, for example, in the City Hospital, which is one of the COVID hospitals, we had 270 intensive care spaces with ventilation, etc. for it. And the maximum number we used at any stage was 22. Now, there's a few other reasons that we may well have dodged the bullet as well. I think the number one thing is moving quickly, moving very fast and shutting down. But that only works if you've got a cohesive society. And this is because we're a small country and the north and the south are the same. And despite all the disputes, it is very cohesive. And people will do the right thing, not because they're forced to do it, but because they'd be embarrassed to be seen by their neighbours not doing it. So we have seen people behaving themselves well. Other people have suggested that there might be a benefit in having a Celtic gene. There's not much benefit in having a Celtic gene, but there might be some protective effect in that the Celtic throughout different countries don't seem to have get hit as bad as people who've got an ethnic origin in Asia or Africa. The third thing is they suggest, and it's a very outline, there's very weak evidence for it, is that BCG vaccination was not stopped in Ireland until 2015. And there seems to be some protective effect of BCG vaccination, but again, that is extremely weak evidence. So the number 1, 2, 3 things were moving early, moving quickly, locking down, and having a cohesive society. It's the answer to COVID is out in society. It's not in the hospitals. We've been very lucky, but we're still quite concerned about, they keep talking about the second wave. I'm not sure we'll get a second wave, but I think it's going to run, COVID is in our society, it's going to rumble on and on. And I think, as both our previous speakers have spoken about, the danger I see is the opportunity cost of COVID, in that we have noticed that subarachnoid hemorrhages are presented late. Carcinomas are presenting late. Red flag head and neck cancers are presenting late. People will not go to the general practitioner because they're afraid that the general practitioner will send them into hospital. And therefore other things aren't happening. Breast screening, cervical screening, there's a whole lot of other things that have been suspended, and they need to be restarted very quickly because that's the opportunity cost of COVID. There's not much else to say except that we're all very relieved that we kind of dodged the bullet, and we're just concerned that we don't open up too quickly again. In fact, the overwhelming majority of people do not want anything to open up, at least until the end of this month, anything to start opening up. And the public have been brilliant. That's really about it.
Okay, thank you so much, Dr. McCoy. I really appreciate your very characteristically heartening but measured perspective, and also the quite sobering note that you sounded at the end, that although people might feel that they may be out of the woods, that there are other considerations. And I think that the fragility of people, the most vulnerable, I think, in society as well, needs to be acknowledged and needs to be not only acknowledged but dealt with, and perhaps maybe that's something that you would like to expand on a little bit later, if possible. So again, there are questions coming, and there are some particularly pertinent questions I think coming from Sheldon Stone, which I would like to bring in later on. Also Dr. Qureshi and a couple of others. So I will try my best to make room for them as quickly as possible. Just before that, we have our keynote speaker today. So our keynote speaker for today is His Excellency Dr. Cevdet Yılmaz. Dr. Yılmaz is the former Deputy Prime Minister of Turkey, also former Cabinet Minister, and the AK Party's Foreign Affairs Chairman. He holds multiple degrees in public administration, international economy and development, and has a PhD in political science. He was appointed to the Directorate General of the EU Relations in 2003. So, Dr. Yılmaz, please.
Thank you so much. Good afternoon from Ankara. I am Cevdet Yılmaz. I'm a deputy in our parliament and also deputy chairman of AK Party currently. And I would like to thank AK Party London for their excellent job in providing us this opportunity. And also I would like to thank all the participants. I will just try to give a framework about Turkey's actually fight against this invisible enemy. But before starting this, I would like to emphasize this. We are confronting a global challenge, actually. This is not a challenge of any single nation. It's a global challenge. No one is really safe until everybody is successful in this fight. You may be a very successful country. You can eradicate all the risks in your country. But if your neighbor is not successful, one way or another, you will face a second wave of this crisis. So I believe that we should understand the global nature of this problem. Of course, there are different national reactions to this crisis, and we have to be in dialogue and in cooperation to learn from each other and to be successful together in this process. And in that context, this dialogue between Turkey and UK is very much appreciated. We are two friends, two allies, and I believe we have a lot to learn from each other, and we have a lot of room to cooperate in this process. So with this introductory remarks, I would like to go into the Turkish case and try to share my ideas about what happened in Turkey. I believe in any other pandemic or disaster or crisis, it is important to be prepared beforehand, before everything starts, actually. And in that sense, I would like to emphasize three important critical areas that our governments have invested over the last 18 years. And these three critical areas helped a lot to Turkey to tackle with the effects of the coronavirus, COVID-19. These three areas are a universal social security system, a very good developed health infrastructure, and the third one is digital infrastructure. And it is also making it possible to have these meetings actually all over Turkey. First of all, this universal coverage and providing health services free of charge to the whole society was very critical in our fight against this virus, and it helped a lot actually to this process. We have done a lot of reforms in our social security over the 18 years. We have integrated different systems. We have made it more efficient and also more universal. And now we are getting the benefits of this system. The second one is health infrastructure. Again, over the 18 years, we have invested a lot in building new hospitals, also using this public-private partnership models, building city hospitals, new models, equipping the hospitals with, up-to-date medical devices, and also increasing the number of staff in our health services. I mean, in our budget, the share of health has steadily increased, actually, together with education. And we believe that giving priority to health infrastructure in all different dimensions have again helped us a lot to fight this crisis. The third element is digitalization. Turkey is now using distance education, for example, for millions of students. And without a good infrastructure, we couldn't have done this, actually. So it also helps us to work from our homes, to have e-commerce, to use e-government services, etc. I mean, this digital infrastructure was also critical in coping with the problems in the process. This preparedness also includes preparing an action plan. Last year, actually, our government have prepared a theoretical action plan when there is a pandemic for Turkey. And it also helped us in this process, actually. There was a division of labor between different institutions. Everybody knew what to do when all the things started because they already had a guideline, a roadmap for themselves that has been prepared beforehand. Of course, it has been adapted to the realities of this disease, but it was a good starting point. And in addition to that, actually, we have acted early in this process. Our Minister of Health and the staff in the ministry, they have established a scientific board as early as January 20, actually. Almost 1 month before World Health Organization has declared this as a pandemic. And that was very critical. This scientific board, they have developed advisors for the government, and more or less government has applied these advisors in this process, and it has helped a lot. We also started right in January, actually, some travel bans with certain countries. And that is why, I mean, these early actions have made us somehow more powerful against this disease. And we have had our first case in March 11, actually. Until March 11, we didn't have any case in Turkey. But after that, I mean, after we have seen the first case, we have developed some new actions, aggressive actions against virus. We have established a good monitoring, testing, and contact tracing system. Especially our Ministry of Health is emphasizing the element of contact tracing and how it is important to lower the cases and also, I mean, death toll in Turkey. And we also established, of course, hygiene rules, social distancing. We have decided to distribute masks free of charge to millions of people. And recently we have also allowed the market work for this. And we have quarantine for 30 major cities and also curfews for risk groups. I mean, people older than 65 and people under 20, they had permanent curfews, and the rest of the society have curfews over weekends, actually. So lots of measures have been taken. And we also, when you look at our healthcare system, we are proud of our healthcare system, like NHS of UK, actually. And maximum 66% of the capacity has been used in this process. So our capacity was more than enough, but still we have constructed some new hospitals for this pandemic, and we believe we can also use it for health tourism in the future. Turkey is also a very good candidate for health tourism. We also used our manufacturing capacity in this process, not only in producing masks, but also we have achieved to produce domestically ventilators, actually. Different groups came together under the coordination of Ministry of Health and Ministry of Industry, and in a couple of weeks, actually, they were able to produce ventilators, and actually we are expecting them to hand over 5,000 ventilators by the end of this month. And they have already started to provide it to some other countries as well including Somalia, for example. We have given Somalia their first ventilators. There were no ventilators in Somalia, and Turkey has given its domestically produced ventilators as a support to Somalia, and we will continue with this. We are also developing many other groups to increase our health service security. I mean, in this sense, I would like to emphasize that in the coming period, many countries will focus on this manufacturing capacity. In such times, it is not enough to have money, actually. You should also have capabilities to produce something with your own industries and with your own institutions. So Turkey has also shown its capability. We have not worked just on the national level. We have also established local institutions, actually. One of the things that we have first established was actually local pandemic boards in each of our 81 provinces, including governorships, municipalities, and all relevant stakeholders. I mean, Lord Burf has criticized us for excluding some local administrations, but let me comment on this. Actually, we didn't prepare any new legislation or regulation specifically for local administrations in this period. Some countries have done this, France or Hungary, some others, they have restricted their local governments. We didn't do this, actually. There is no new regulation in Turkey. We are just acting under our old or, long-term regulation. We have also established, as I said, these participatory mechanisms. What we are objecting about this ministry, some of the ministries, actually, most of the opposition ministries, they worked in coordination with central administration, and that was required for efficiency of reaching people. That was our actually concern. If you don't act in a coordinated way, then you create chaos. You may be duplicating your help to certain families, but giving nothing to others. So that was the concern of the government, to coordinate the actions. And most of the CHP local governments, they have actually acted in line with this coordination requirements, and we had no problem. But some of them, they tried to act in isolation from these coordination mechanisms that have been established, and that was the problem, actually. And later, we have overcome it, actually. And in addition to this, we have increased the financial resources of local government. Our government have suspended the payments of local governments, whether they are from our party or opposition parties, it doesn't matter. We have increased the financial resources of local governments in this process so that they could better serve to their communities. And they have done this, actually. Many municipalities, they have provided hygiene services, social services, and many other infrastructure services in this process. So I believe it is not a fair description of what happened in Turkey, but of course we would like to see no such thing in such processes down the way, actually. So far, as I've said, it has been a small quarrel with this big picture, but I think we will not have additional ones in this process. Apart from this national fight, we also made our best to help other countries, actually. Turkey has taken actually calls from around 130 countries, either as in terms of help in providing certain things as grants or giving export permissions, etc., etc. And we have supported around 60 countries with our medical equipment and other equipments. And we believe that is required, that is our duty actually to do this. And it is also a call for global solidarity actually in this process. This pandemic is all over the world, but it acts not in similar times in different countries. It started in Asia, it moved to Europe, now the epicenter is US, and now the developing countries are coming in. and we have to cooperate more for supporting these developing countries, refugee communities in particular, and vulnerable groups within refugee communities should be our concern. And poor countries, the countries that don't have strong health sector infrastructure, should also be supported in this process. And I believe Turkey and UK can cooperate in this process to reach out to these countries. When we actually go out of this crisis, we should share our experiences with each other, and also we should act together in third countries to help others to cope with this problem. And we also actually helped more than 60,000 of our citizens come back to Turkey, and also we helped around 20,000 foreign citizens to go to their own countries. That was also a big operation for us, and we have managed this actually. So we are also using everything we have to help our diaspora actually. We have a large diaspora in Europe, in some other countries, and we are trying to do our best to reach out to them as well. So we are doing everything we can to reduce this crisis. So far, I mean, the peak has been seen in Turkey, and now we are going down actually in our numbers. Let me also share the numbers, recent numbers. So far, we have done around 1.5 million testing, 138,000 positive persons are identified in Turkey. From among them, 93,000 has been healed so far, actually. So around 2/3 of our cases are now healed and they are out of hospitals. And I am not a medical doctor, I am not a specialist, but our health ministry is saying that we have an algorithm that works better to heal the people. They are healing earlier and they are better. And that is also reflected in our death toll. Only 3,786 people have lost their lives in this process. Of course, even one person is quite significant, but comparing with other nations or neighbors, Europe and the rest of the world, we are quite successful actually in limiting the number of deaths in this process, and we are continuing to fight with it. And with Europe, we also started to talk about normalization. As Lord Barfe has talked about the interaction between economy and health. I believe in the coming weeks, we will discuss more about economy and how can we have an economy, a productive economy, without sacrificing our health objectives. That is the challenge for all of us. And again, we need to share experiences in this normalization process and recovery for the economies. We cannot go on forever with locked down cities and productive facilities. That is clear. And as has been emphasized also by Lord Barfe, governments are getting indebted, and one way or another, we have to pay for this. So we have to do everything we can to increase the health security of people, but also normalize the life and recover from this process economically. Otherwise, especially the vulnerable sections, poor people, unemployed people, they will be relatively more affected by this process, and we will have many other different effects. So we also started to some normalization steps in Turkey. We are gradual, we are cautious, but we have started to take some steps. Actually, today is the start of the new period in Turkey. This is a slow normalization. Today, barber shops will be opened in Turkey, and also some shopping centers, actually, with, of course, some guidelines, some precautions, etc. And also, we have given, in this weekend, we have given 4 hours of leave for our elderly people, people above 65. They could enjoy outside. After 2 months of lockdown, they could go outside and have some exercise when other people were in their homes, actually. Over the weekend, the general public was at home, but our elderly people could enjoy the streets actually for themselves. So we are taking these steps, and every week we will review the developments and take some new steps. And as I said, I believe we can learn from each other, not only in fighting with COVID, but also in this normalization period and recovery in the coming weeks. So let me leave here. Thank you very much again for giving this opportunity.
Thank you so much, Dr. Yilmaz. I really appreciate this, and thank you for drawing our attention to the phenomenal efforts made by Turkey for addressing actually some of Lord Balfe's points. So that relieves me of the responsibility of repeating them, and also for drawing together many of the threads that were explored since the start of the seminar. I think it's really key as well to this whole concept of sharing good practice and sharing initiatives that work globally in a sense of global collaboration, I think is key. And I think this is a theme that is being repeated and revisited throughout the seminar. So we have plenty of questions actually. And what I'll do with participants' permission is two things. I'll group similar questions together. Many of the questions have a common theme, and I will also, if they have not been directed to a particular speaker, I might direct them myself. So there is one of the questions to start us off. There's a question from Sheldon Stone. I think they'll probably express it much more eloquently themselves than have me read it off screen. So Sheldon, if you'd like to please switch on your video and activate your mic. Perhaps you have your question directed to Lord Balfe. Would you like to share that with us?
Yes, I would. Can you hear me? I have unmuted myself.
Super, we can hear you very well. Please go ahead.
Okay, fine. Well, Lord Balfe has had an interesting career, having crossed the House back in the 2000s. I don't think your criticisms of the NHS are valid, particularly coming from a party that has starved us of funding for a decade. We have got a 40th of the ITU beds of Germany, and that is purely down to austerity. Your party carried out a huge, expensive, and inefficient reorganization in the form of the Health and Social Care Act. This included major reduction in funding, and it made public health an arm of government with centralization of its large regional laboratory networks. This contributed considerably to the failure to test and trace, which would be the infection control measure of choice. Now, I speak as somebody that, although a general physician, was very active in the hand hygiene liaison group. I've raised millions of pounds in research on reduction of superbugs and control of infection. And our group actually put alcohol hand rub into the NHS. Now, the disastrous results of the pandemic simulation in 2016 were not acted on by your government. It's not the inherent scleroticism of the NHS, but the appalling political management of the NHS that is responsible for the current debacle. And Johnson's peroration yesterday was dangerous, confusing, and premature. The plans for lockdown exit are imprecise, and they will be as disastrous as the Health and Social Care Act, the welfare reforms, your privatizing probation, Windrush, the 33 hours of free childcare, and the performance of government for the last 10 years has been weak. As weak, incidentally, as the government's support for Hong Kong and for the Uyghurs. Now, having said that, I was very impressed by Turkey's response, and having looked at their figures, which have about 1/12 of the deaths of the UK, I would like to know what they are doing for the Uyghur refugees who are in tremendous trouble at the moment, awaiting asylum, and therefore very susceptible to COVID. How are you helping that community?
Dr. Stone, thank you so much for that. That was a very full question. I think there's plenty of material there to answer. I appreciate everyone's expertise on this group, actually, and there's many people who have deeply passionate views, and I'm glad that they're coming to the fore and that we're having a robust conversation. Please forgive me if I do move people on. It's not intentional. It's just so that we can fit as many participants as possible. So Lord Balfe, just before you answer that, so that we can maximize time, could I please read out a couple of questions while you are preparing your response, particularly to Dr. McCoy? There are a few participants that are picking up in particular on your comments to BMAE groups or regarding BME groups, and picking up that you might have mentioned that in Ireland in particular, they are doing markedly better than the disparity that we are witnessing in mainland UK, and how the BMA community needs to perhaps have particular strategies in place, particularly now that there are noises being made about lockdown relaxing, and how they have been disproportionately affected, not only psychologically, you mentioned that, I think, in your initial few words, but also economically and in other ways. So Lord Balfe, if I could ask you please to respond to Dr. Stone, and then perhaps we can bring in Dr. McCoy. Thank you.
Can you hear me?
Yes, we can hear you very well. Please go ahead.
Well, I'm not sure what the response is. It was just a general rant on behalf of Jeremy Corbyn, as far as I could gather. And the Uyghurs and China and God knows what else. The fact of the matter is that the NHS has some very serious questions to answer. The supposed reforms clearly aren't working, but there are more people in the NHS paid more than the Prime Minister than there are MPs in the House of Commons. So I would suggest that the NHS, when this is all over, there will be an inquiry. And I think one of the things people will be looking at is why there are so many empty beds. Why have the cancer treatment and the cardiology departments closed down? And they're very serious questions. If I had the answers, I'd be a very rich person.
I think these are unprecedented times actually for everyone. And I think it's really important that in the spirit of collaboration and openness, sometimes questions that are painful do need to be asked, but quite often that's when we do address them, that's us halfway through to the solution. So Dr. McCoy, perhaps if I could bring you in there, please, and if there's something that you would like to comment on in the previous question and also the other questions that I read out.
I mean, I can't really comment on the NHS, and it's we have certainly in Belfast attempted to keep other services going. As I said, followed the model, saw what they did in Wuhan, which is they had fever hospitals and then they had other hospitals, and we've attempted in the Royal Victoria Hospital making it the other hospital to keep certainly red flag cancers, even retinal detachments, head and neck cancers, cardiology, neurology, etc. going at all times, and even the transplant. The thing about the ethnic minority effect on ethnic minority healthcare workers, we don't have high ethnic minority levels here at all, but we have had one death in a healthcare worker, and that person was from an ethnic minority. And it seems in other countries they've seen the same thing. I don't know, it's going to be the history books, it's going to be studies that are going later to see what is it that caused it, but it is something we do need to be conscious of. Again, I don't know what the answer to that is. But I do know that countries that have moved fast, quickly and tested have done better than other countries that haven't. One thing I will say about the response in GB, or Great Britain, was that there was an article in the New England Journal of Medicine after the initial response of the politicians in London and the SAGE group. They said it was under the advice of the SAGE group. And the article in the New England Journal of Medicine thought that their initial response was a parody. They were quite stunned that they were mentioning things like herd immunity and what had become colloquially called let it rip, and let's see what happens. And then the modeling suggested you could have hundreds of thousands of deaths, and then they reversed score. So not alone, I think, in London did they not move quickly, but their response was incoherent to start with. And as WHO have repeatedly said, the virus will always catch you.
Yes.
So that's really all. I mean, I wouldn't like to get into the politics of the NHS. That's way above my pay grade, I'm afraid.
Okay, so on that, thank you so much for that. But on that note, actually, there are a few points that are being made also by participants. So what I was worried would be the sort of the elephant in the room that Lord Bath actually did mention the concept of Brexit and at the start of his speech, but also how you perceive things progressing from there. Dr. Stone, perhaps also you would like to chip in here and Dr. Yilmaz, and how the fallout from those particular, from that political tsunami, if you like, that emerged from Brexit, how that impacts interaction now, and whether or not you perceive that this may be a change in policies in the future.
Can I enter?
Yes, please.
Oh, okay. First of all, actually, I have forgotten to answer one of the issues that has been raised by Lord Balfe about this Turkish support, medical support to UK and some irregularities. First of all, it was not about public-to-public cooperation. I mean, this public-to-public aid from Turkey to UK, we didn't have any problem. The problem was one private company that has been contacted with authorities of UK to provide some medical staff, and unfortunately some of their staff, not all of them, were not regular. So we have UK government have informed us about this, and we have done everything we can as a public authority to compensate for this and help this UK authorities in this process. So I should emphasize that it is not between countries, it is between UK authorities and a private company. Unfortunately, this private company was not properly controlled within Turkey. Probably that was because we had this unfortunate event, but the level of problem was not very big, so it was somehow mitigated by the cooperation between two governments. About these refugees, I mean, Turkey is hosting almost 4 million refugees from Syria, and if you include others from Iraq, Afghanistan, and Iraq, it is about 5 million. I mean, this is Turkey's #1 country hosting refugees, and due to Turkey's sacrifice, actually, many countries in Europe are relatively better off, actually, in this process. But this is a very heavy burden for any country. Turkey is a developing country. We are not a very rich country, but still we are doing everything we can. We are sacrificing a lot in this process. I just want to stress the need for international cooperation for refugee issues. It is a humanitarian issue. It is not just a problem of one single country. It is our own common problem. So we have to cooperate more about how to, I mean, support these refugees. Of course, in my personal view, the more important thing is political solution. I mean, when you don't have political solutions, you deal with humanitarian disasters and crises. I hope UK and Turkey can cooperate more about solving the political issues in Syria, and also in the meantime we should cooperate for humanitarian assistance to refugees and also displaced persons, millions of persons within Syria. We also have an Uyghur refugee population in Turkey. We don't know the exact number, but it is probably around 30,000, and they are well integrated into our society. So we don't have any specific problem for Uyghur refugees. Of course, the situation in China is another debate. I believe Uyghurs or others, all human beings in this process deserve to have best medical supports in the process. And Turkey has always raised its support irrespective of religion, ethnicity, or any other identity. I mean, we shouldn't play identity politics in this. We shouldn't make differentiations between people's identities. This is the humanitarian situation. So every country and also international community should help people in this process, especially the vulnerable people, without looking to their identities. Thank you.
Thank you so much for that. Actually, these are comments that I'll be reading out now that reflect plenty of what the participants are saying. In the meantime, actually, Dr. Stone, I'm not sure whether you're there or not. Your video seems to be deactivated, but if you can hear us and you'd like to rejoin, please do so. We dearly like your participation in the Q&A sessions. So some of the common threads that are coming up in the Q&A tab here from participants are, one of which, for example, there's an elected councillor that we have in Luton in the north of London, who mentions that local community centres, Turkish community centres, have been involved in providing support to communities in Luton during this unprecedented time. And people's opinions on how such contributions provide positive impact on an international level, as well as a local one between UK and Turkey relationships. So that's from Councillor Javira Hussain in Luton. But also a lot of the common threads that are coming through the questions now are the pioneering work and quite often model work that is done by faith communities, local communities, and others, quite often people who have the least but give the most, and also stand to lose the most by the impact of this, not only COVID-19, but things like, for example, austerity measures, issues like, for example, social consequences, housing, inequalities when it comes to accessing certain resources, whether online or so. For example, now we're holding this session online, and there are many households, not in the UK, only in Turkey, globally, who are underprivileged and do not have access to things that others might take totally for granted, such as, for example, broadband or electricity that is affordable, and need to make very difficult decisions about whether or not to, for example, heat their homes or use or use the internet for a certain period of time. And that's not, that's not a stark picture. I think that's something that many might relate to. So are these issues that you feel that you might like to comment on, please? So
who's that thrown out to, that question?
Yes, I see that you've muted your mic. You've unmuted first, so please go ahead. Dr. McCoy.
Again, it does come down to cohesiveness always. If you can get a cohesive part of society or society, it makes all the difference. The usual, I think it's been pointed out earlier on about opportunity costs. It is the poor who are going to suffer for this. Now, the poor are going to suffer possibly because they live in poor conditions, they live in high concentration households, there may be an increased risk of obesity and diabetes and hypertension, all the things that make you at risk of it. But the overall thing is there's a whole load of other things going on during this crisis. There's probably a lot of alcoholism, there's probably about domestic abuse, there's probably child neglect or anxiety and children, psychological things. There's going to be a whole load of other things. There are going to be PhD theses written all over the place on what the effect of this crisis has been. And the effect is going to be very far reaching, I think, like the other speakers pointed out today. How it's been mitigated, again, we don't know. We won't know for years about how and what mitigated the response to this properly in society. I mean, I think it's far too early. As the Chinese always say, it's far too early to decide what all these effects are going to be or how they're mitigated.
Yes, thank you. Okay, another very pertinent question that's come through now, and I'm trying to bring them in as quickly as possible. I'm aware that time is ticking. So perhaps this one is for yourself, Lord Belf. How would panelists in general rate the behavior of the US, both domestically and globally, in dealing with this pandemic? They appear, the question asks, to be acting like a global pariah in undercutting even their allies whilst purchasing PPE on global markets, constantly attacking the World Health Organization, blocking action at the UNSC, UN Security Council, the G7 and the G20, and even blocking emergency IMF loans to countries that they don't like, for example, Iran. Are they going to be the great losers of this pandemic, ? So I acknowledge that it has a crystal ball, and the question is interesting, but please go ahead.
Well, I'm very sorry about the United States and the way that it's behaved, because they're so inconsistent that really the world that had come to depend on them can only stand back in sorrow. We always look to the United States as we used to say, the leader of the free world. But today it is just a completely irrational group of people. And I'm afraid that when I look at the president, I don't see a leader even of the United States. I see someone who, appears to be completely out of control. I am sorry, because I think that the growing preeminence of China is something that is going to dominate this century, and that really we all need to stand together. I remember a conversation I had many years ago with President Demirel after he was stood down from the presidency in Turkey. And he said to me, if you add all of the Muslim world around the Mediterranean to all of the Christian world around the north of it, we need to stand together. And I remember I was with him for 2 or 3 hours at lunch, and we discussed the things that the Muslim faith and the Christian faith have in common, and the way in which we should be working together, because the faiths of the Far East are far different to ours. I mean, we do have a lot of common values, and we must build on them. It's as simple as that. And I'm very sorry to see the United States deteriorating into this sort of beggar my neighbour and have a go at everybody. I mean, no one, it appears, is safe from the invective of the American president.
Right. Yes. Well, thank you for that. I will return to you, Lord Balfe. Just before that, I'm aware that Dr. Salter needs to leave shortly, and I appreciate that he has come. He stepped in for a colleague at short notice, so I'm very conscious of his time. So, are there any comments, Dr. Salter, that you would like to wrap up with, or any final thoughts before we return to Lord Balfe and Dr. Yilmaz? And sorry, your mic is off, I think.
That's
Oh,
right.
yeah.
I agree with Lord Balfe. The WHO is a fundamental UN entity that has to be supported, because it effectively is the only truly international health grouping that can discharge functions globally to ensure that the most difficult to reach groups are reached with the support that they need to deal with not just COVID, but the exacerbation of other health issues, which are only going to be further made more difficult and more challenging by the COVID-19. And I think Dr. McCoy touches on exactly all of this. COVID-19 will exacerbate the social inequalities, both in the UK and I assume Turkey, although I'm not familiar with Turkey and its health system, but certainly in the UK, the consequences of which will be running for many generations. And young people and older people now going through what they're going will have mental health, physical health, and other issues which we need to find ways of supporting. We can mitigate in some small measure, I'm sure, but they are consequences which we will have to reflect on and deal with as the years and decades go by, because this is a lifetime effect for the lifetimes of all our young people. Over.
Right, thank you so much. I'd like to take this opportunity actually to thank you, Dr. Salter, just in case you do need to leave us, and appreciate the time and effort that you took to step in at the last minute. And thank you very much. We are looking to We're looking up to wrap up in about 5 minutes time. So we will hear a few final comments from Lord Balfe, from Dr. Yilmaz, Dr. McCoy. Also, just before, I would like to invite participants to leave your emails with us for future updates, and of course to access the AK Party UK's Facebook page. For media and other queries, we'll be reading out an email, and there will be a screen later on. And what I have tried to do is try to group the questions as much as possible. If there is anything that we have missed out, please do forgive us. I think the points that have come up, they are repeated. There's the Uyghur question we have mentioned. There are questions regarding the recommencing of flights between Turkey and the UK. There are other questions inquiring specifically about Turkish policy. Perhaps those might be emailed directly to the email that we will provide at the end of this webinar. I could invite you, please, to participate. Dr. McCoy first, then Lord Balfe, please, and finally Dr. Yilmaz.
I'd just like to say that I've very much enjoyed this webinar. I think certainly from speaking to my colleagues over the last, this is the 8th week we've had of the crisis, that everybody says the same things. Nobody sleeps well. They wake up in the morning and for a microsecond, everything's fine. And then they realize, actually, everything's not fine. I've just remembered about COVID-19. And at the moment, it never seems to end. However, I will say what has astonished me about it is, one, how good the public have been in keeping to the rules. But secondly, how fantastic my colleagues have been. And when I talk about my colleagues, the overwhelming majority of the people I work with every day are poorly paid and poorly treated. They are domestics, cleaners, porters, auxiliary nurses, etc., etc. And yet they turn up day after day after day, and they put in extra left, right, and centre. And what one thing I do hope, although I don't think it will happen, is that in 6 months' time or 12 months' time or 24 months' time, when they go looking for something, maybe just an acknowledgement of what they do, that it will be listened to and not forgotten too quickly. That's all.
Yes, thank you. Thank you actually for that very moving point. And that's something that I'm keen to stress, and I'm sure everybody will join me in acknowledging and paying tribute to. And quite often it is the people who are the unseen and the unsung who do lose the most, who do sacrifice the most, and who are the most indispensable to society, nationally and globally. So thank you for that, Dr. McCoy. Lord Balfe, would you like to continue?
Well, firstly, I'd like to endorse everything Dr. McCoy has just said. I think one way, very tangible way in the United Kingdom that we could help is by taking the people who've served on the front line and giving the lowest paid a decent bonus, the next lowest paid a medium bonus, and those a little further up, but still under, the average, a smaller bonus, because it's the people right at the bottom, and Dr. McCoy is right, who've got up every day and often without protective equipment fully in place, have gone out and helped and saved many in our population. The next thing I'd like to make a point is to Dr. Yilmaz. I was very careful in my words. I was not criticising the government of Turkey because of the PPE equipment. It's quite clear to me this was a matter at a commercial level. And indeed, we need to thank the government of Turkey for its help to the British people at this time. So no criticism there. And I do also recognise the enormous sacrifice Turkey has made on refugees. I also, at the risk of being a bit controversial, would like to rephrase that term. Many of them are economic migrants. They're not refugees. There is no limit to the capacity of the number of people who would probably like to come to Western Europe. I can understand why, but I do not accept they're all refugees. But having said that, I do think that we need to help Turkey. We need to settle down and have joint approach with Turkey to help it with the problem, which has given it more of a problem than the whole of the rest of Europe put together. And I'm afraid there are just too many people in comfortable Northern Europe who are not recognising this and are not offering to Turkey the friendship that it widely deserves. I've enjoyed the webinar. I enjoy my contact with the AKP, but I have to say, above all, I'm a friend of Turkey, not of any political faction within it, because I want to see the Turkish people happy and in a democratic society. So as such, whoever they elect to be their government will have my support and help.
Thank you so much, Lord Bath. Thank you for clarifying, and thank you also for your measured words. I really do appreciate it. Dr. Yilmaz?
I would also like to thank you and all the participants for their very valuable contributions. I myself benefited a lot from these discussions, and I hope it will continue, this dialogue between different specialists and also people from different countries. We need this dialogue for coping with health problems and also economic and other social political problems. And I would also like to emphasize that in this fight, we should work together with civil society. I mean, without social support, we cannot manage to overcome these difficulties. And as has been emphasized, it is critical. And also we have to work together to for global solidarity for this. In some areas, we will have emphasis on self-sacrifice, self-sufficiency probably in the coming years. But in others, we should strengthen global coordination and cooperation. We need this, but unfortunately, the leadership at global level seems to be quite weak for this requirement. We should somehow discuss about this issue in some other context. And for the flights between UK and Turkey, of course, we would like to see it as soon as possible, but we don't have yet a schedule for this. Government is working on such issues. Probably it will be decided between governments. I mean, if two countries have reached to a level in this process, probably they can have this opportunity for mutually considering reopening of these flights again. But I cannot make any guess for this actually at the moment. About health workers, I would also like to finish my comments by giving tribute to all these health workers that are on the front lines in this fight. As Turkey, we have done three things for them. First, we have applauded them actually in different ways, and there is no financial resources required for this. But apart from that, we also increased their pay actually in this process. We are paying billions of Turkish liras to health workers in this process. And on top of this, we also made a regulation in our parliament, increasing the penalties for violence against health workers, actually. So we are very much grateful to the work of our health workers like anybody else in this webinar. I would like to thank you again for this opportunity, and I hope, as I said, we will continue. Thank you very much.
Thank you so much. Thank you to each and every single one of you. We can all agree that there is light at the end of the tunnel, regardless of challenges and obstacles. And I think COVID-19 has forced many it has been a catalyst for many to step back, to reevaluate, to explore new commonalities and new avenues of cooperation, to rise above previous disagreements, and hopefully that is a new dawn. A new dawn is in the coming. So to conclude, I'd like to thank you, each and every single one of you, distinguished panelists, everybody who worked behind the scenes. In the spirit of acknowledgement here, there are many who worked behind the scenes to bring this webinar together that are not too keen on being mentioned publicly, but I'd like to thank them and acknowledge their efforts, and of course to all the attendees and participants today, without whom this webinar wouldn't have been possible. So I would like to remind you again, please, to check the email that will be on the screen presently, info@akparty.uk, if there's anything that you would like to communicate with us on, and to follow the Facebook, where a recording of this webinar will be made available presently. Thank you very much.
Thank you.
Thank you.